Thanks for watching Mid Morning this Tuesday. In this week's February, we're focusing on mental health. And one of the things that we've seen during the rise of the pandemic is telehealth.
Dr. Cedric Skillon at Hazelden Betty Ford is one of the leaders in developing telehealth for the organization. Joins us now on Skype. Dr. Skillon, thanks for being with us.
Thank you for having me.
You've sort of been ahead of the curve on this because you used to live here in the Twin Cities. And when your wife got a new job, that's when you kind of pounced and started a telehealth operation for Hazelden Betty Ford, right?
Yes, that's true. And I'm really thankful for the opportunity. And it was one of those things where you're not sure if you can do it, but you kind of calm yourself down and say, well, it's not much different than any other practice in person. So we put together the logistics and the structure, and we've been doing telehealth services since 2016.
So, Dr. Skillon, a lot of places really had to scramble to start up their telehealth. You've been doing it for 4 years before the pandemic. What have you seen? What have you heard from your patients when they have these telehealth experiences?
Actually, most of my clients felt like it's a great opportunity for them because, one, it makes it easier for them to be able to make their appointments. I mean, there's no longer you have to take off work or miss a half day to be able to go to see a provider. I mean, I've had people literally go out to the car and have the session for 30 minutes on their lunch break in their car. So it definitely improved accessibility. And I actually have a client that I'm treating that lives in Minnesota, but near the Canadian border. So I would never be able to treat that client before.
Do you think this is expanding access to mental health treatment for people?
Oh, definitely. I mean, because it's not unheard of, like in rural areas where people may have to drive a couple hundred miles to be able to see a psychiatrist. So there may be only one in the county. So this is definitely creating a lot more opportunities to be able to service all the people in the community.
Doctor, I wonder, I mean, it's the access part of it is wonderful, but I wonder, do you still have the same impact when you're not seeing someone in person, but rather talking with them about some really serious stuff over a computer screen?
I've actually found that it's been the same. I mean, I really haven't found a difference. I think the most important thing when you're building that rapport with a client or the relationship is listening, taking the time and not rushing. And people can tell if you're taking the time to listen to them, making sure that you understand their concerns, and then any decision going forward, as long as you're saying, this is what I think is going on, here are the risks and benefits of options. What do you think? It's building that teamwork. That's the most important thing, I think, in a care with any client. It's not necessarily having to physically touch them or be in the same room.
I know in traditional, I shouldn't say traditional, but like in much of the medical world, insurance has been sort of slow to catch up in covering sort of the telehealth visits. What is the reality of that when it comes to mental health visits?
Yeah, I agree. It has been a slow process, but it has been gaining momentum, and I would say, especially with mental health, because we so very rarely need to actually touch the patient. I actually think it's moved further ahead compared to other disciplines. But definitely with the pandemic, it's sped up the process by years, and so I think there's greater accessibility and coverage from insurance.
We know that Hazelden's been doing this for a while, but Doctor, I wonder with other health systems, do you think that they will continue this telehealth even after the pandemic is over when it comes to mental health?
Oh, definitely. I mean, I guess that's a strong statement, but I don't think you can go back because, again, it's so much more accessible. I mean, there are people to where, you know, if you have to make a decision between being off work versus going to, you know, your appointment or have another treatment, it just improves accessibility. I don't see it going back. Now, I think we will have in-person services available, but I think this will be a nice augmentation strategy going forward.
Really good. Dr. Cedric Skillon, good reminder for people during the pandemic to take care of their mental health, and you can do that through these telehealth visits as well. Thanks for being with us. We appreciate it.